my name's JC. I'm going to be your nurse today. Would you mind telling me your name?
I'm Abby.
Okay, is it okay if I call you Abby?
Yeah, that's fine.
Okay, so Abby, what's your birthday?
0317-2000.
Okay, awesome. So today we're going to be performing a head to toe assessment, if that's okay with you. Okay, awesome. So I'm just going to wash my hands real quick and then we'll get started.
Okay.
So would you mind telling me what month it is right now?
November.
Okay, and where are we right now?
Johnson City.
Okay, perfect. So now I'm just going to check your blood pressure.
Okay.
So if you wouldn't mind sitting your arm up here. Okay, so that was about 132/78. Does that sound normal to you? Okay. Okay. So now we're going to move on, and I'm going to start with the assessment of your head.
Okay.
Okay, so first I'm just going to look at your head.
Okay.
So your eyes are symmetrical, eyebrows, eyelashes, all that look good. Okay, so now I'm going to shine this light in your eyes.
Okay.
Check for your reflexes. Well, first I'm going to look at what size your pupils are. It's about a 6 on both sides. Okay, I'm going to put my hand right here and then I'm just going to shine this in your light to check for your eyes to check for your reflexes.
Okay.
Okay, reflexes on both sides. They are symmetrical. Okay, now I want you to look at that wall.
Okay.
And whenever I put my pen in front of your face, focus on that.
Okay.
Okay, your reflexes are symmetrical in both eyes, bilaterally. Okay, now I'm going to assess your ears.
Okay.
So I'm just going to look at those, put your hair behind your ears. Okay, ears are symmetrical, pink, no lesions or bumps, any tenderness. Okay, no drainage.
No.
Okay, awesome. Okay, now I'm going to assess your mouth.
Okay.
Lips are symmetrical. Nose is symmetrical in the face. Okay, so now if you don't care to open your mouth.
Okay.
So your mouth is pink and moist. Can you go ah for me? Okay. Everything looks good in here. Can you raise your tongue? Perfect. Okay. One more thing. Do you care to pull down your eyelids so that I can check? Okay. Sclera and conjunctiva look good.
Awesome.
Okay, awesome. Okay, so now I'm just going to move on to the arms.
Okay.
So I'm going to be using my hands to feel for warmth and to just assess if there's any lesions or bruises or anything like that.
Okay.
So I'm going to push your sleeves up. Okay, so no lesions, no bruises. Okay. So you have a scar. What's that from?
I burn it in the oven.
Okay, so there is a scar on the right arm, lower arm. Other than that, no lesions. Okay, I'm gonna feel them with the back of my palms,
Okay.
or hands. So warm, dry, skin is pink. That's good. Okay, now I'm gonna check your hands and fingernails. So there's no clubbing. Capillary refill is less than 3 seconds. No clubbing. Less than 3 seconds. Okay, now I'm going to pull this up and examine your legs now.
Okay.
Okay, so no lesions or bumps or bruises on either of the legs. Good. Okay, so I'm going to remove your socks to test for edema and things. Okay. Okay, so No edema. She does have toenail polish on, so I cannot check for capillary refill. Okay, so can you flex your feet? Okay, now push against my hands. Okay, that's good. So you have a strength of 5, and then I'm going to feel for your pulses on your feet, your dorsal pulses. Okay, grade of 2 on both of your dorsal pulses. Okay, we can cover back up now. Okay, and then I need to check your radial pulses, so I need your wrists again. Okay. Okay, radial grade of 2 on both arms bilaterally. Next, can you just grab my fingers and squeeze them? Okay. Grip strength of 5 on both hands. Okay. Next, I'm going to have you lie down, and then I'm going to assess. Well, you can sit to begin with.
Okay.
I need to do your. So I'm going to do your heart sounds, your lung sounds, and then I'll have you lay down for the bowel sounds.
Sounds good.
Okay. So just relax, and I'll listen to your heart, and then I'm going to go with this side, and I'm going to flip it over. That doesn't mean anything's wrong. I just have to listen to make sure everything's okay.
Okay.
Okay. Heart sounds were present in all 4 quadrants. Heard presence of S1 or S2 in all 4 quadrants. No murmurs or bruise, so that's good. I'm going to listen to your apical pulse. So I'm going to put my stethoscope back up here.
Okay.
And I'm going to have to time that for a minute.
Okay.
Okay. You have a pulse rate of 72, which is in the normal range, so that's good.
Okay.
Okay, next I'm going to assess your lung sounds and look at your respiration to make sure everything's symmetrical.
Okay.
So just take a deep breath for me. Okay, chest rises and falls symmetrically, so that's good. Okay, so now I'm just gonna put my stethoscope back in some different areas on your chest. I will have to go under your shirt at some point if that's okay with you.
Mm-hmm.
So every time you just feel my stethoscope touch your skin, just take a deep breath.
Okay.
I'm gonna start here. Okay, now I'm gonna get up your shirt. And if at any point you feel lightheaded, just let me know.
Okay.
Okay. Breath sounds sounded good in both lungs. No presence of crackles or wheezes. And now I'm just gonna do the same thing on your back, okay?
Okay.
I'm gonna lift your shirt up. Okay, now I need you to lift your right arm, and I'm just gonna put this underneath your armpit so that I can listen to your lungs on that side. Okay. Okay, perfect. Okay, once again, breath sounds were present and no crackles or wheezes. Okay, so now I'm gonna have you lay down and I'm going to assess your abdomen.
Okay.
Okay, so we'll keep this here for privacy. And then we'll just go and lift your shirt up a little bit so that I can get to your abdomen. So there are no lesions or bruises on the abdomen. It's symmetrical. Everything looks normal. Okay, so I'm just gonna feel in the different areas of your stomach. Okay. Okay, bowel sounds were normal active in all 4 quadrants and present. And now I'm just gonna palpitate on your stomach a little bit. Let me know if you feel any tenderness or anything hurts whenever I'm pressing down. Okay. Okay.
Mm-hmm.
Okay.
All good.
Okay. There was no guarding and no enlarged organs, so everything seems to be checking out good. Okay, so the last thing I need you to do is stand up, and I'm going to look at your spine and palpitate and see if you have any signs of scoliosis or anything like that.
Okay.
Okay, so I'm just gonna lift your shirt up, and just look at your spine, palpitate a little bit. Any
Okay.
tenderness?
Mm-mm.
Okay. So if you'll bend over a little bit. Okay. Spine is midline. See no signs of scoliosis or kyphosis. Okay, perfect. Okay, I think that's all. You can sit back down if you would like.
Okay.
Okay. So are you comfortable? Do you have any questions about what we've done today?
No.
Okay, awesome. Well, thank you. And I'm just gonna wash my hands, and then you let me know if you need anything, okay?
All right. Thank you.
Thank you.